Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we welcome you. Thank you very much for joining us. Today, we are pleased to have with us Dr. Stephen Conaty, Director of Environmental Health Branch and Health Protection New South Wales. Dr. Stephen, thank you for joining us.
Pleasure.
We also have Dr. Daniel Guo, General Practitioner. Dr. Daniel, thank you for joining us.
Thank you very much.
And online joining us is Christopher Liu, Acting Clinical Training Officer of the New South Wales Ambulance. Christopher, thank you very much for taking the time to be with us today.
Thanks for having me.
Today, our focus is on heat and keeping safe this summer. It's come around so fast. Dr. Stephen Conaty was here last year to talk about how we can keep cool during the summer, but keeping safe. But we'll talk about that soon enough. Please gather your questions and put them on the chat. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are meeting from today. We pay respects for elders past, present, and emerging, and pay respects to Aboriginal colleagues who may be joining this session today. Dr. Conaty and Dr. Daniel and I and our team from the New South Wales Health and MHCS are joining you from the land of the Camaragal people of the Eora Nation. We'd also like to extend those respects to the multicultural communities and refugee communities who are represented in this session. So we shall start. Dr. Stephen, it's only spring, but we're already feeling the heat. Sometimes it's cold, but it gets really hot. Can you tell us what the Bureau of Meteorology is predicting? They say it could be a very hot summer.
Yes, that's right, Jess. So it could be a hot summer. It's always, predictions are always difficult, but the climate is generally warming, and so we could expect that this will be a warm summer, and but it may also be wet. So that's so there's two things that go together that may be occurring. So yes, it could be hot. Heat waves and shorter periods of hot weather can seriously impact people's health. People might not realize that extreme heat events like heat waves are responsible for more deaths than all other natural hazards combined. And hot weather can affect everyone, and it can be dangerous. There are a few heat-related illnesses that can impact your health, and so you've got to be aware of them. So they include heat stroke, heat exhaustion, heat cramps, heat rash, and dehydration can increase the risk of developing a heat-related illness.
When you say dehydration, that's really important because sometimes we don't drink enough water, and when it is really hot, that's when we need to make time to hydrate, isn't it? Dr. Daniel, Dr. Stephen mentioned that the different heat-related illnesses. Are you able to tell us more about what are the signs and symptoms that we should be looking out for, and when we know that it could be heat-related?
Thank you very much. Yes, the heat-related disease and some mild type of the heat-related disease we are well known, like heat cramp, heat rash. Okay, the heat cramp is just like it's similar to some soccer players. They play by the end of the games, they have a muscle cramps because of dehydration, because of sweaty loss of electrolytes in the bodies. Okay, so that's a warning sign for you to go to the cool place to rest and to get more waters. It's better to have some salt or sugars in the waters to drink. Okay,
why is that?
You lose a lot of sweat, and inside of the sweat there's electrolytes, and that can cause the muscles to get to less of the nutritions. Okay, so but that's a mild type. If you ignore, and they can turn into the most severe type of the heat-related disease. Usually we call like heat exhaustion. Okay, heat exhaustion certainly happen in the hot weathers, and when you lose a lot of water's dehydrations, okay, it start to affect your bodies, your brains, your important organs, and your body is still fighting for that, right? And people at this stage can feel dizziness, have a faint feelings, headache, okay, if you were thirsty and sweaty, even nausea, vomiting, that's all the signs, okay. Muscle weakness, muscle cramping can happen. And in this stage, you need immediate medical attentions. Found the close by medical centers, call your doctors, call your friend to help, okay. If you still ignore these signs, it can go to most severe type. The most severe type we call heat stroke. And in this stage, your body already is very difficult to coping. It struggle to coping. And your organ, your brains has fundamentally affected.
So it could be really serious.
Yes. It can be life-threatening. It's a life-threatening conditions. People looks like stroke. So it can present it as confusions or even loss of conscious, slurred speech, or even seizures. And they can surprisingly have a very dry skins, or sweaties. And muscle twitchings or seizures can happen. And yes, certainly, this is the times to seek immediate medical help.
And medical help is when where Christopher Liu is able to represent the ambulance. Before we ask you that question, Dr. Stephen, who are at risk? I mean, we know that everyone can experience all these illnesses, but who's the most at risk, and who should we be careful about and making sure that they're safe?
I should just say that everyone continues to be at risk of heat. So even if you're very fit, and we always see these people who do turn up to the emergency departments who have participated in races, maybe in very hot weather, or they could be workers who've been working on a roof during a very hot day, ordinarily very fit, but they're exposed to extreme heat, and they develop one of these acute illnesses that Daniel has spoken about. However, there are some groups that are at particular risk. And so they include older people who are over the age of 65 and babies and young children from 0 to 5 years. And then some other groups like pregnant women, outdoor workers, socially isolated people, people who are homeless, and people with pre-existing medical conditions. And I should just say that, there are reasons why these people are at higher risk. And that's because because of their stage in life, they're probably not so good at compensating when the weather is very hot. And so it's much, and occasionally there's also behavioral reasons why they may not. So they can't, maybe they're immobile and can't move out of a hot area of their home, or can't do that without a carer. So there are, there's multiple reasons why these groups that I just spoke about are at higher risk.
Christopher, with your experience working with the emergency department, could you tell us what you've seen during the hot weather and what your team would respond to?
Yeah, I think, as Dr. Stephen and Dr. Dan have already sort of mentioned, it can sort of affect almost anyone. Obviously, you've got groups that are more prone. So you've got the elderly, over 65, generally speaking, and then you've also got the younger kids and that kind of thing. But obviously, as an ambulance service, we will attend. The cases will spike in summer, unfortunately for us. A lot of the time, they're often due to inappropriate activities, inappropriate attire, and we basically try and treat what we've got. As the doctors mentioned, heat stroke, heat exhaustion, there's different levels that we would treat. I've turned up to someone on a 40-degree, 1 o'clock in the afternoon, he was mowing the lawn. Let's just really think about what we're doing at 1 o'clock. The UV, it's the hottest time of the day, and we're mowing the lawn. Of course, you are gonna literally evaporate all of your fluids. You'll be dehydrated very much so. We've got people that are clothed inappropriately. You might see some people doing some running or exercise, which is all well and good. They pick the wrong time to do it. They're doing it again in the middle of the day. They're wearing really tight clothing. They're wearing multiple layers of clothing, which again is just trapping that heat. And then, all your sweat's coming out, and then eventually you start to go down the path of hypothermia, or in this case, heat stroke, heat exhaustion. babies in particular, I think, and pets as well. I think we all might have heard that tragic news story recently about the police dogs that were unfortunately lost because the air conditioning malfunctioned in the car and the temperatures increased dramatically. Same thing with human babies as well. I've definitely been to a couple of cases where we've had babies trapped in cars. Their core temperatures have just gone up. It only takes a few minutes. Thankfully, the babies were okay. We did an assessment and they were fine. But that was definitely a point in my career where I was a little bit scared. I won't lie. Realistically, it's just a case of maintaining our fluids, keeping ourselves hydrated, so clear fluids as well. We see a lot of cases where people have just dehydrated. They just haven't been drinking enough water, or they've been drinking lots of coffee, which dehydrates you. They're drinking alcohol, which is also dehydrating you. You know, it's the festive season, it's Christmas, you're out the beach playing. Just sometimes you just need to think about what we're doing in the heat. You know, all the advice, slip, slop, slap, seek, slide. We want to make sure we're eating like a lot of veggies that have some fruit in them. We can, vegetables with high fluid contents, fruits with the same as well.
Oh, well, thank you very much. I'd just like to thank you and everyone here, to Dr. Stephen, Dr. Daniel, and Christopher for responding. I mean, if when you hear that, it really is scary. What happens? You think that you just close the window, open the window, maybe it's okay, and with just a split second, things could happen. Dr. Stephen, it is pretty scary to see all that come about when lives could be lost.
Yes, no, it's that's tragic, and we don't want that to happen. And so it underlines that heat can be dangerous, and it's dangerous for the groups that we've already talked about, but dangerous for anyone who overheats.
Yeah, and I guess the question is, how do we prepare ourselves, our homes? You mentioned, Christopher, that the heat is at 1 o'clock, and that's when knowing the time when it's really hot, preparing yourself not to go out, or preparing your home. What could we do, and what steps should we be doing to prepare our homes and ourselves for summer?
Yeah. No. Thanks, Jess. This is very important, because I mean, we're everyone lives. Well, most people live in a home, so we need to think about what we can do to make that place safe for ourselves and our families, and cool. So the things that you can do to the place you live, and there's also personal cooling strategies that you can employ. So we firstly, just check that the things that help to cool ourselves and our spaces are things like air conditioners and fans. So you want to make sure you have. Yeah. So and that keeps me cool. That's portable. So that's excellent. But so often we have fixed air conditioners, and we have standing fans or ceiling fans in our homes that are very important. And first hot day, try to turn it on, and you think, oh, this is not quite right. It's not working. So just think ahead. If you can, now is a good time to be just going around. If you haven't already started to use your air conditioner or fan, some of us already have. You can. It's good to check that they're actually working. It's also good to check your refrigerator and freezer. That's because sometimes that'll come under extra strain during the summertime period, and that's really for you don't want to be caught out with food poisoning. If you know that there's another way that you can prepare is if you're listening to weather reports and you know that there's a period of very hot weather coming, make sure that you've got all the things that you need, because you don't want to, like as Christopher said, go out in the middle of the day when it's really hot. You want to have maybe the things on hand and so you don't need to make those trips. That's a bit of preparation, though. Not all of us are so great at doing that. So it's but that's something that we can do. Yeah, and I think you're right in terms of just being prepared. A lot of people talk about rain. When it's raining, then you prepare yourself, and it is the same thing, preparing yourself for hot weather. That's right. There's also important other things that you can do in your house that we haven't talked about in detail, but it's important to think about your windows, the places where you get sort of that extra radiant heat coming in from the sun, and can we cover them with blinds? Can we put something on the surface of them? Maybe we should be installing awnings. That's obviously that's an expense, and not everyone can afford it in these times, but they're things that we can that we can do. And there are some simple things that we can do to try and insulate our home. Remember, if it's hot outside and it's cooler inside, you want to be shutting up your home. So you want to be closing those doors, you want to be closing those windows so you don't let the hot weather into your home. Okay. But when it cools down outside, then you can open your windows, open your doors. So it sounds basic, but it's something that we're probably not so good at doing in Australia, and I think that's something that we are, or that's part of our of what we now need to be conscious about doing. So your home becomes a cooler refuge, or at least cooler than the outside most of the time.
Yeah, and if you have any questions, please add them to the chat, and we'll get Dr. Stephen, Dr. Daniel, and Christopher to answer your questions. Now, a lot of people are working from home. So a lot of working from home. So it is about the condition of when you're working from home, and how do you make sure that when you're working and so busy that you're keeping cool as well. So what do we do? I guess, Dr. Daniel, what are your tips for that, and how can we, do it on a personal level? How do we prepare ourselves?
There's still a lot of things we can do. I think make a plan and prepare early and in detail is very important. From medical point of reasons and in the personal levels, and I think it's most important to get your doctor's detail, your pharmacist details available, and once you need it, call the numbers and get some help. And also you need to know some source of information you can get, like a health director, to help you to get more information about how to beat the heat. Okay, and look after each other's. Keep contact with the friends, families. That's very important. Look after each other to be safe. And especially for some people, they have a chronic disease, the elderly people, young kids. And you can think about to have some modern technologies, okay, especially like if you have the medical alert bracelet, make it available all the times. Okay, so for the old people, 4 alarms, make sure always working, check the batteries. And you may like to speak to your doctors if you have some chronic health conditions. And if you take the regular medications, keep the medical medications always available. Okay, so be prepared in advance, like Dr. Conaty said, right? You don't need to come out to go to the pharmacy to get in the very hot weather. Okay. And safe storage for the food, for the medication is very important. And especially in some particular conditions may have a power failures. After the power failure, check again, check your fridge, check your freezer, and make sure to be safe. And I think it's important to know also about your local area. Okay, just in extreme conditions, you need to get some relief, like a public place like libraries, shopping centers, they're well conditioning, air conditioning, so you can get a relief from the heat in extreme hot weathers. And so some parks or have a lot of trees shade, that's kind of helping. Cool.
We have some questions. Thank you very much for the questions. We have a question from Michael Kamek. Do we have any information experience with people from culturally and linguistically diverse backgrounds because of religious practice? For example, women wearing hijabs, and for those who may be wearing things for in terms of cultural practices. What should we be doing in terms of advice as well? I think it's just making sure they're keeping cool.
Yeah, that's an excellent question, because I mean, normally we would say wear loose-fitting clothing, and some cultural dress, of course, can be loose-fitting, but it may be need to cover the entire body, and so then it becomes because that then becomes an issue of being in a cooler space, and so it may not be that is available to you, and so that needs to be recognized, and we need to then tailor that message to some of our cultural groups in our community.
Thank you. And what would your advice for patients or client, your patients that would need extra information?
There's some information or sources like Health Direct, or the common information is all available in the internet today as well. I think the clothes-wise, we always advise to be like loose fittings, okay, lightweight, and I think that light color is very helpful in the hot weathers, and also choose some material to be moisture wicking would be more helpful as well. And be prepared early. If you have to doing some activities in detail, can help you. Like freeze a bottle of water before before the night, and it's give you some relief in the.
Yeah, there are questions about where their information in terms of brand types of alarms you can recommend to diverse communities, and some information is not available in some emerging languages. We do have information that are available in different languages and beat the heat information, isn't it, Stephen?
That's right. Yes. So we have multiple translations of our information on the Beat the Heat website. That's right.
And we're trying to make sure that they're all available in languages.
We'll make sure that's information to be available in the clinic. Okay.
I'd like to ask Christopher, how weather and hot weather can also often mean bushfires as well as heat waves. So yes, it get very hot, but what are some steps we can take to prepare for the bushfire season? And what is your team also doing to prepare yourself for this season?
Yeah, so there's a lot of work, obviously, in terms of the bushfire season. We're all well aware, I think, 2020, I think, was 2021, we had some horrific bushfires a few years back. And after then, we've all sort of undergone some training. Obviously, we're not firefighters, we're obviously the emergency ambulance service, but we work closely with our firefighter colleagues and vice versa. So generally, if there's a fire, if you've got RFS or firefighters in breathing apparatus, you'll more than likely also have an ambulance there just to assist. And obviously, if there's any patients that come from that, we'll treat them. In terms of how we can stay healthy when there's bushfire smoke about, like obviously it's not just when there's a bushfire that we have smoke. Where there's smoke, there's fire. Often will be, I think even now, already starting doing back burning and things like that. And so you'll probably seen in the news, Sydney wakes up in a blanket of fog or smog. Generally speaking, that will obviously affect the air quality. So there are resources we can do. You can just jump on online, Google the air quality in your area. I think there'll be some links posted after, and we can follow the recommended advice based off of obviously the air quality. Obviously your doctor, the Aboriginal health workers' advice, we should obviously be listening to them. If you have known respiratory conditions, if you have known triggers for example, maybe some asthma or something like that, and your doctor says, hey, look, this is coming up, maybe don't head outside, it might trigger your asthma. We want to obviously be the basic advice for that side of things, where you, like Dr. Daniel mentioned, pre-plan, pre-prepare, have your GP, have your pharmacists on the phone, be able to have a supply of your Ventolin or your medications that might be. You don't really want to be needing it and then having to walk out in the smoke to go and get yourself some more medication. That would be not ideal. In terms of just some generic advice, I don't know if this is going to answer the question, but I think just spending some more time indoors and avoiding outdoor activity would probably be ideal. Obviously in the heat and obviously in the smoke, you're just going to be exposing yourself. I know it's probably boring just sitting at home, but obviously we can entertain ourselves in other ways. Obviously you want to try and keep the air inside the house clean as best as you can. So I know a lot of the air conditioning, you've got recirculation now. You can also make sure that the windows are closed. Obviously the night before you might have opened up the doors and windows to allow that cool air, that cool change to come through. But I remember my mum, she used to open the windows, open the doors at like 7 o'clock when it got dark, and then she'd keep it on until like 5:30, 6 o'clock in the morning, and then she'd close everything up. She didn't like to use the air conditioning at home. So we would head out to the shops or to the movies for a day if it was going to be a particularly hot day, 38, 39, that was hot back then, but now it's like 40 degrees is an average day. We just head out there and find somewhere cool to hang out for the day, go do some shopping, spend most of the day somewhere else that was, out of the sun.
It's the question also, where can people go if they want more information? And I also wanted to ask right after that, when you can answer the question, is in terms of if you do have to and go meet people who may not have language, who may need language support, how do you respond to that?
Beg your pardon?
If there are people that, for example, you've had to respond to some patients who need language support, how do you respond to that as well from the ambulance?
I think for us, for obviously in the pre-hospital care setting, we kind of do our best. If we can't really communicate because there is a language barrier, and we see this quite frequently, we've got a dedicated translator service with ambulance where we are a client basically, and we have a priority number which will connect us to a translator. We can pick basically which language we need. Obviously, the initial part of working out which language and the initial 5-10 minutes of the interaction can sometimes be a bit of a mind game. But overall, we have systems in place for us to do that. They're fantastic. They're available 24/7 to us. So most of the time, if we're stuck in the interim, it's not really kosher, but we do sometimes use family on scene. Obviously, if they're just what we have there and we can get a quick story based on what's happened, then the family will tell us, what's happened and what language they speak. And then obviously we perform an assessment and then we engage the translator service, because obviously if you've got someone acutely unwell, getting on the phone when the person's unconscious, probably you've got to reevaluate your priorities, I guess.
That's great. Thank you. There's some questions online, and maybe we'll get back to you. There's a question on information about wearables for emergency situations, and what can you tell us about brands and in types of information? I know that in one of the sessions before, we talked about resources in terms of if it's really hot and there's fire, then there's a brand of smoke alarms, which is really important to use. But we can possibly put that out in some of the information that we send out with the recording. But in terms of, I wanted to ask, so thank you very much, Christopher. In terms of food, when you plan things, and food can be really, can go bad. And like you said, Dr. Stephen, in terms of preparing what you need for the home, when it gets hot, it could take risks in terms of how they can go bad, and that could be another risk for patients. Yeah,
it certainly can be. So so that's just we've got to. Everyone has to take care with food preparation. And being able to refrigerate foods that are a bit higher risk, as well as being able to thaw appropriately in a refrigerator are things that we need to do at all times. But obviously, when the environment is much warmer, then those bacteria and other things within the food have an opportunity to multiply far more quickly. So that's why we've got to be careful about leaving food out for extended periods of time prior to eating it. Maybe you prepared it several hours beforehand and you left it out on a warm day. That can be a problem. So that's why it's good to have cooler spaces in your house and a fridge that works.
Doctor?
Yeah, I think it's similar. So in the summer times, and the food is more easy to get bad, get rotten, and medically, like gastroenteritis is these times is always popular.
Yes.
So it's
that's right.
yeah. So personal hygiene is more important, and keep the food in the good place, always fridge, in the fridge or freezer, properly storage, and check the expiration date, expire date, before you eaten, and wash hand all the times.
and water as well, because just making sure you're hydrated. And I understand that sometimes when the water's too hot, or you have to also start refilling water as well to keep your safe. We've run out of time, almost there, and it is really important. Like you said, I'm going to make a plan. I think that's important, and checking in on families, especially with families who may be isolated, who may be far away. what are your tips for making sure that we're contacting the families and friends?
Well, that's exactly right. I mean, as you've described. So and so we need to think about our neighbours and our family, and when it is very hot weather, if we have their telephone numbers, we can just give them a quick call and just say, are you doing the right things about, maybe is your house shut up at the moment? Have you got cool space? Are you feeling uncomfortable? And then you may be the person, if they can't get to a cooler place in their house, maybe you're the one who's going to be able to do that for them, or perhaps take them, as Christopher mentioned, to a cooler place, which can just be like a shopping centre. Relief for a few hours can be very important, and we can't stay there all the time. But that's an important way of giving your body relief. And so that can be a really important role that you could play for a person that you care for.
Thank you. I want to call on Christopher. Any last words for the multicultural media, the health workers, and community members who may be online today?
Look, to be honest, I think we all know it's going to be a very hot one. Again, no one's surprised by that. I think some of the take-home messages we've had a chat about was to just make sure that we're prepared. Obviously, we want to make sure that we're ensuring we're adequately hydrated throughout the summer. I think we've beaten it to death talking about just staying out of the heat, but it is such a simple thing for us to do. And having been, the one who will show up when something has gone wrong as a result of that before we take them down to the hospital or whatever it is that's required, I cannot stress enough, if we just dress appropriately, if we just drink lots of water, we make sure we're doing the right things at the right times, not going for a run at 1 o'clock in the afternoon on a 40-degree day, I think we'll be okay. Bushfire smoke is always going to be about just make sure we're checking the air quality and things like that. If you need any advice, you've got Health Direct, you've got your GPs, even the chemists, the local pharmacists will definitely be able to help you out with anything that they need as well.
Thank you very much, Christopher, for taking the time to be with us. Dr. Daniel, any last tips for the people online today?
Heat can be dangerous, and in the summertime, be well prepared in detail, and stay contact each other and look after each others, and we can beat the heat.
Thank you. And Dr. Stephen.
Yes, I think we probably haven't managed to touch a lot on maybe all of those personal cooling strategies. Remember that there is a lot of information available on the Beat the Heat website, and including on if your environment is really warm, even in your home, there are things you can do with your fans, with water, just spraying water on your skin, and so there's. Look at the website, and you can get some tips for staying cool, because that's what we want to do.
Thank you. And that's available on the New South Wales Health website and the Multicultural Health Communication Service website as well, in English and multiple languages. So thank you very much, Dr. Stephen, Dr. Daniel, and Christopher, for joining us. And thank you for being here. The recording of this session will be available on the New South Wales Multicultural Health Service website and will be shared with you through email, as well as links to information on beating the heat and in languages and in English. Thank you very much for joining us. Join us again the next fortnight, and we'll see you again. Take care, stay safe, and stay cool.